Many of our rural communities are facing the threat of losing critical health care. Not only are we talking the possibility of loss of life here, we're talking hundreds of millions of dollars in lost revenue and hundreds of people losing their jobs. That's why Congressman Byrne is now fighting the government for our small town hospitals. Every year, more than 35,000 people walk through the doors of the ER here at Atmore Community Hospital. How much longer these doors will remain open is up to the federal government.
If you close a hospital in any community, but particularly a rural community, it's devastating to the community.
Why the threat of a closure not only to the hospital in Atmore, but dozens of hospitals across Alabama's rural areas? It comes down to money. Alabama hospitals are not getting reimbursed by Medicaid and Medicare like hospitals in other states. Urban hospitals can pretty much sustain the loss. Smaller rural hospitals cannot.
So Alabama hospitals, on average, receive 20% less than other hospitals across America for things that they do that reimburse from Medicare on.
Why the disparity? Reimbursement is based on a state's pay wages.
Alabama's a poorer state and gets paid less because it's a poorer state. But at the end of the day, we're expected to have, and do have, the same quality health care, the same expenses, and the same regulations associated with any other state.
Alabama Congressman Byrne held a roundtable discussion with health care administrators today on how to make reimbursement of Medicaid and Medicare equal across the nation. He's calling on Congress to make changes. Byrne says if rural hospitals are forced to shut down, communities will be devastated.
It hurts in three ways. Number one, people don't have that easier, quicker access to health care, and sometimes time is of the essence. Number two, these are jobs in that community, and they've lost those jobs. And number three, it's hard to attract new business and industry to a community if you don't have a hospital.
Atmore Mayor Jim Staff says his city would lose millions in revenue every year, and that's just the beginning.
Disaster if this closed. 225 employees, $137 million. Is what the economic impact.
They live in this community, they pay city, state, federal taxes, they buy things in the stores, and so the multiplier effect of the impact.
Now, Alabama's not the only state battling health care reimbursement. Tennessee and Texas are in the very same boat.